that, and she says, okay, this is lower left. Then I pick it off of her finger and I put it right on the tooth so I don't have to think about it or anything. I don't have time to look at the number because I can't see it anyway and all that other stuff. So I just look at the curved surface. I trust her that it's right. So let's load this now. And the loading comes here. Take this cap off. Then it's got an angle or a bevel tip to it. And then the bevel tip is going to what you have it so it's going to get wetted or on the inside. Do we have a light on the phone to see so we can see it better? Thank you. So then we're going to dispel some of that cement out, and it just goes like a thin layer all the way around. So this is dental assistant doing this. And then here it comes to me with it all loaded up, and she says that's the lower left, so we're going to put that on the lower left. Now here comes the hydraulic pressure part. Squish that down so the cement comes out the bottom. All right, so the cement comes out the bottom. Then I don't want to make a mess out of that. We're going to clean it first so I can see what I'm doing. And then I'm going to use my pusher and push this down to get it in the right place. Close the margins around there and evaluate the fit. Looks pretty good. Clean it again. Make sure I can get it. Q-tip would also be nice. I like just 2x2s. They work better than this. And I'm not trying to make a mess out of this. Type it out so it looks good. See cement out the gingival, and I didn't bring my curette to clean it. And I don't know where the curette went.
Yeah.
Thank you. So get that out of here. Yeah, that's fine, thank you. And there's a little bit, can you see that cement on the inside there? So that tells us that the band is full of cement. It's got the margin sealed all the way around the bottom. Then once you're all happy with it, if the kid's good, you don't have to go on to the, you don't have to cure it right that second, but usually, kids are pretty juicy, so we're gonna light this up right away. And then it's gonna be 20 seconds and it just transilluminates through the teeth. You don't have to do the gingival or any of that kind of stuff. And almost. And done. All right, so that's good. And then you can pick that stuff out of the top if you want to. That's a really good fit right there. Okay, so the waxing, again, probably not necessary because I was pretty careful, but.
You recommend this versus waxing, yeah? You like this better? You like this better than waxing?
Well, just that's nice because if you have that mini chapstick, you're going to hand it to the patient. Yeah. So now you say, here, Mr. Patient, here's your chapstick. So, they're 50 cents a piece. But ortho wax is just fine too. I'm just saying that this would be easier. And you saw Krenwich was doing it with a blob of wax to push it out the bottom. But I'm not going to do it that way. I'm just going to use my thumb because I don't have a blob of wax right here. So again, we'll cement this on here. Put a thin layer all the way around on the inside.
After you hit it with a light, how long does it take to cure?
Pardon?
How long does it take to cure?
20 seconds.
In his cure?
To be on the safe side, you should probably go 30.
These are dual cure anyway, no?
No.
No, that's like
It's just coming out of a single syringe.
I suppose, like Dr. said, you could go sand it out in the sun. Eventually it would get set, but not the best idea in the world. So I want to make sure it's all wetted on the inside. I totally missed the buckle because my thumb was on top of it.
So do we have band remover plier to check how well it's on there?
You don't use any bond on this, right?
No.
Yeah, so if things go well, you shouldn't have too much flash in there. So like you see how it's wetted all the way
That's
around
what
the
I'm saying.
inside,
There's no bond or etch on it.
all the way around the inside, so there's no voids. Good, and then we'll recap that. So here's the finger, this is Leslie's finger, and then I'm gonna take it right off of her finger and just put it right on the tooth, so no looking at it, measuring it, or looking for a size or anything else. Hydraulic pressure, push this down, force cement out the bottom.
No bonding on the tooth, yeah?
No etch.
Nothing, it just has to be dry. Now we start the driving force. These are strong enough bands that you can push on the buccal, excuse me, the mesial and the distal, but the last driving force should be on the buccal and This one should have a cleat on the inside. Oh, I don't have a cleat. I don't have a cleat to push on. They should have put that cleat on that, but didn't. Okay, now I pick up a 2x2 off my little girl's chest, bib, I should say. Put that right here. So the distal needs to go down a little bit more. Push, push, push.
If it has a crown on it,
If it has a crown?
would you have to surface treat the porcelain on
Nope.
it or no?
This is a mechanical type retention. It's not a chemical kind.
Okay.
That's why there's no etching or anything on here. Burnish it closed. She already had it nicely burnished. That's why I chose hers, because I wouldn't have to do too much work. Clean out the cement here if you want to. And then dental assistant, light that up. And it looks pretty good.
Exactly.
No, that's gonna waste a tip, sorry.